Good morning. My name is Ryan Patrick. Today I'm going to speak with you on PTSD, who's affected, what's the symptoms, and what are some of the treatments. The reason I have chosen PTSD as my topic is because I believe that PTSD is something that is actually common in most people, but unfortunately we do not know enough about it. So what exactly is PTSD? PTSD is actually post-traumatic stress disorder. Is a psychiatric disorder that was commonly known in the later 19th century. Before that, previously, it was known as soldier's heart, railroad spine, or shell shock. It's been linked to neurological disorders and has also been linked to some type of illness or even a traumatic incident that has affected somebody. A person normally will have difficult recovering after an experience or witnessing some type of trauma. The statistics that have been proven, have been shown that an estimated 7.8% of all Americans will experience PTSD at some point in their life. Approximately 5.2 million people have PTSD in one given year. Treatment is normally, they say, has to be done within the first onset of symptoms that have been shown. If you can get the treatment within that time frame, typically you will not end up having any type of long-term effects from PTSD and will be able to live with it and control it. Some of the different causes of PTSD. One of the most common ones that I think people really associate PTSD with is soldiers when they come back from war. But if you read right here, it actually tells you that when this study was shown, less than 6% of the people that were interviewed actually had any type of war-related illness or ever even went to war to begin with. On here, physical assault is the highest with 70%. There's some of the other ones you'll see are sexual assault. Typically you'll see this in children who have been assaulted at a young age. Also, car accidents. You will also see a large number of people who have been involved in some type of severe car accident where they were exposed to severe trauma or experienced that trauma themselves that will suffer from PTSD. Other professions that we see that have it are law enforcement, fire department, and any type of medical personnel. So when you think of, especially right now with what's going on in the world with COVID-19, you can only imagine that the experience that a lot of these nurses and doctors are having, and they end up actually developing PTSD from that. So what are some of the symptoms that we see with PTSD? There's behavioral. The behavioral is agitation, hostility, hypervigilance, and self-destruction. Typically, you'll actually see a lot of people who do not actually get the treatment, or they actually speak with a therapist in enough time they can go into what they know as the homicidal, suicidal tendencies. The psychological symptoms are flashbacks, fear, severe anxiety. Then there's mood, which is guilt and loneliness, or loss of interest in their typical hobbies that they may have liked before they experienced this trauma. Sleep, which is, I feel like, one of the big ones that a lot of people who have PTSD tend to experience, is the insomnia and nightmares. Also common is any type of emotional disconnect. If you notice somebody that would be more upbeat and has that sentimental type personality, and then all of a sudden they no longer have that, there's possible that something has happened to them that has caused them to have this disconnect from other people. And unwanted thoughts, going back to the suicidal, homicidal tendencies. So what is the risks of untreated PTSD? You have abuse of drugs and alcohol. This right here is one of the ones that I feel that you see a lot, especially with soldiers when they come back from war. They feel that they cannot go and talk about what they're experiencing, so they resort down to using drugs and alcohol to help coat that unnecessary feeling that they have from the PTSD. Severe anger management issues. Again, another one we see with a lot of soldiers when they come back. They have so much built up anger from what they've seen and what they've gone through, and they don't know how to handle it and control it. And then the homicidal, suicidal tendencies. What is the treatments for PTSD? There's behavioral therapy. I feel like this would be one of the biggest ones that most people really need to understand, is that they're able to go and talk with a therapist. It doesn't make you any less of a person. what it's going to do is help you to understand what you're going through, how to cope with it, and what you can do to make sure that you're not acting out and you're able to control what behavior issues you may be experiencing from this illness. Anger management, which ties right back into the behavioral therapy. Going to anger management and expressing how you feel. Having somebody who may be able to understand, who's gone through the same experiences that you've gone through. Being able to talk about that. And then, of course, there's anti-anxiety depressant medications. In some severe cases of PTSD, there may be a medication that you need to be prescribed to help you also cope while going through your therapy sessions as well. So in conclusion, although PTSD, mostly being known to military vets, is common, everyday individuals like you and me may be at just as high of a risk, if not higher. Treatment is imperative to help those who suffer from PTSD. That cannot be reiterated enough, that treatment needs to happen. In order to be able to cope and understand what you're going through, treatment has got to be the top priority for the person who is suffering from this illness. Finally, anyone who suffers from this disorder should know they are not alone. Talking to others and getting help is not shameful, but courageous, because the person is not afraid to get help. That is needed to overcome this disorder. So with that, I want to say thank you for listening to my speech. I hope that this gave a little bit more of an insight as to what exactly PTSD is and how we can control it and what we can do to help those who suffer from it. Thank you.